I'd like to welcome you and thank you all for coming today to talk about coronavirus. We set up this coffee hour this morning for you because we've heard that there's been a lot of questions that have been asked to some of the staff here at the Senior Center. This is a very informal setting. We're here for you today. We're not going to stand up here and present to you formally on what the coronavirus is and the numbers. We'll answer your questions if you do have some. We'll give just a brief introduction to the coronavirus, but we're not going to do this presentation. This is your hour. We're here for you today. So it's an opportunity for you to ask any questions that you may have. And no question is off the board. And I'm telling you right now, we might not have the answer, but we will take this back with us and we'll figure out and we'll ask the right questions to the people who may have the answers. So that's what we're doing here today. So again, thank you. I'm going to hand off the microphone to Jenny for just a few minutes to give you a brief introduction onto what the coronavirus is, and then we're going to hand the microphone over to you so you can ask questions. This is attached to a wall, so if you can't project loudly, you'll have to come up and use the microphone to ask your question because I'd like everyone to hear it. All right? So Jenny, take it away.
Hi. Well, let me do this without spilling coffee. That would be terrible to throw coffee at a coffee hour. No bueno. I'm Jenny. I'm a public health nurse for the city of Northampton, like Meredith said. So there's been a lot about the coronavirus, and a lot of it seems redundant. A lot of it seems like whiplash, what's new, what's not, what's outdated, what's good. And some of what I'm going to say is going to be redundant, but that's because it's really important, guys. Some of the things we're going to tell you seem like common sense, but the more we can, adjust our brains to these habits, the safer we can all be. So coronavirus is a kind of virus. This includes SARS, MERS, a lot of these types of viruses, and it's called that because it looks like a little crown when you look at it under a microscope. Kind of cool. And so the name of, if you get infected by this specific kind of coronavirus, the illness it gives you, they've named COVID-19, which stands for Coronavirus Infectious Disease 2019. We get super creative when we name things. But it's also important that we named it that way because it was really important to not tie this to any one geographic region or race or ethnicity because that adds stigma, right? We've been seeing a lot in the news about different Asian Americans whose businesses have been impacted and whatnot. So it was really important when they were naming this to show that this is a disease that can impact anybody. It just happened to have started in China. And that we're seeing that right now, right? It's spreading all over our world. And that's because of both the wonder and the terrible that we are a very interconnected society, and what affects one area of our world will inevitably affect us. So COVID is transmitted in the exact same way that cold and flu are, which is why a lot of the messaging you're hearing seems very redundant, because this is the best protection you can take, is to stay 6 feet apart from people you're talking to because it's spread by droplets. And if you're more than 6 feet away, the droplets won't get that far, they'll just drop. So if you think of how far that is, it's generally about an average gentleman's wingspan, right? So if a person is 6 feet tall, their wingspan's about 6 feet. So think about that. I'm 5'9" for perspective, this far. So that's the first thing. The second thing is covering your coughs into your elbow, because if those droplets make it into a mucous membrane, eyes, nose, mouth, that's how you get infected. So try not to cough into people's eyes. It's just kind of rude. No one likes it. So that's number 2. The third thing is wash your hands. And this sounds like such simple information, but the fact is a lot of us don't wash our hands enough. We don't wash our hands thoroughly enough. They say, sing a little song. I have a 3-year-old, she likes to sing a song with her hands flat, but she sings her ABCs every time she washes her hands. I'm like, no, kiddo, you gotta actually scrub. So it can be complicated, we live busy lives, right? So what we recommend, pick the chorus to your favorite song, old, new, hip, oldies, whatever. Sing it while you wash your hands. And then also do little motions. I learned this for my toddler and I thought it was pretty cool. Wash your hands like you're doing namaste. Wash your hands like you're making a butterfly. Wash your hands like you're milking a cow. And then wash your hands, I can't remember what we call this one, maybe a spider. But it gets all the motions and all the nooks and crannies, right? And that is the best way to prevent transmission. Because transmission of any respiratory illness that's transmitted like this comes from, generally, if people aren't sneezing right in your eyes or your mouth, I sneeze, falls on the table. You come along, eat your lunch on this table, and you rub your eye. You're sick. So the only thing you have control over how much it gets disinfected are these guys. So wash them a lot. That is our best advice. I've been saying, if you think you wash your hands enough, up it by 50%. So that's kind of, the basics. And I'm sure you guys have heard a lot, but hopefully putting a different spin on it. Every little thing we hear helps it sink in a little more, right? We all learn differently. So if this works for you, cool. So that being said, it's really hard to talk about how many cases, where, when, all of the technical things, because they change very quickly. I was listening to a Senate hearing for the Mass State Legislature yesterday, and as they were talking, they were checking their phones and realizing what they were saying was outdated. So while I could stand here and parrot numbers and countries and things, that could all change tomorrow, it could all change by the time we're done. So focusing on prevention is really where we're trying to focus our efforts. So that's a brief little overview. So like Meredith said, we'll open it up to questions. We don't want to sit here and lecture. So
my question is, how long does the virus live on the surface?
So it's a really good question. We don't know. This virus is so new, which is why why people do feel scared, is new things are scary. And so because of that, scientists are looking into these things, but we don't know yet. One of the things I heard yesterday is based on other similar coronaviruses, SARS and MERS could live on surfaces for between 4 and 5 days, depending on the permeability of the surface, depending if it was plastic or metal or wood. So one of the things we're doing is working with a lot of our local institutions about increasing disinfectant usage and making sure we're wiping down those high-touch surfaces. You guys personally wipe down your phones a lot, anything that you touch very frequently, that you might have other people touching very frequently, clean them. If you can find Clorox wipes. Or just disinfectant wipes in general, yeah. So.
Say that again about the wipes. What wipes are you talking about?
Question? We can't hear. Sorry, she asked about if there's any type of disinfectant wipe in general. For commercial institutions, we're working with specialized cleaners that are specifically designed to kill coronavirus. For the average consumer, we haven't gotten any super good guidance, but for hand sanitizer, they say something with at least like 60% alcohol content. So I would, look for something pretty similar with what you're going to be disinfecting your surfaces with. I don't know, Clorox is generally like, bleaches.
Mm-hmm. Lysol.
Yeah. The person with the puffy vest on last row.
I'm not sure, why soap works, but that's great. But when you're out and about, and, I used to carry diaper wipes in the clean green time. But as far as the antibacterial sprays in those wipes, it seems like one ingredient is in insecticide, actually a known really bad thing on the list of you don't want to really have it in your body, and that's one of the main ingredients in those things. So.
Yeah, I'm not intimately familiar with ingredient labels, and I can say, don't use a Clorox wipe on something wear dish gloves when you're using it. They're things that we clean our surfaces with.
I'm talking about when you're out and about, and you want to, you're in public, and, going into a bathroom, wash your hands, and you're going out in public where people just touch your hands. So if you want to carry a hand wipe, is this any different, or just keeping your hands clean with a hand wipe would be good, you don't need some special?
No, so the benefit to washing your hands with soap and water, and it doesn't have to be an antibacterial soap too. It can be a regular liquid. They do recommend liquid soaps. Foam doesn't have the same contact on your skin, it washes off easier, and bar soap, if you don't wash your hands long enough, you risk if they're I told this to my husband last night when he said, why not bar soap? And I go, well, if you put a raw chicken breast on top of bar soap and then take it off, the bar soap isn't going to automatically chew up all the salmonella. It's going to be on top. So if you then wipe your hands on salmonella and then don't wash your hands for that 20 seconds, it's going to be pretty moot. But liquid soap, and soap in general, what it does is it's a surfactant, which means it kind of encapsulates everything that's not your skin. All of the bacteria, all the little microbes, it captures them in a little bubble and makes them slippery so they slide off your hands. So that's what the soap does. And the main way that you get that soap to encapsulate those little things is that vigorous scrubbing for 20 seconds. Just putting soap on your hands and letting it wash off. You're not, think of it on a big scale. Think of it like you're, mashing thing, just, you want to pick it up. If you just put something on and wash it off, if you think you have a big chunk on your hands.
So
It's not.
that's what I mean, so the handy wipes might not necessarily be that great because
They're not going to kill anything. They'll wipe big particles away, but they're not necessarily, so if you have a glob of peanut butter in your hand, it's going to get rid of it. But droplets and stuff are really small, so that's they're not going to have that same bubble around it quality, So.
Would you recommend preferably to always wash your hands when there's soap and water available as opposed to using the wipes at all?
Absolutely.
Yes, and so the question was, so people can hear, would you recommend always using soap and water over wipes or hand sanitizer? Soap and water is always preferable. The thought behind hand sanitizer is better than nothing. It's good. There's a continuum, but especially for visible soil, if you have visible stuff on your hands, alcohol sanitizer isn't going to get rid of that. You want to do the cleaning as well. And that's something we do as someone who used to work in a hospital, that's protocol from a hospital, right? You can use, when you don't see anything on your hands visibly, you can use sanitizer, but they still recommend every 4 or 5 times you use hand sanitizer, go and wash your hands. So.
How are we going to provide accurate information, or how are you in the health department when all the other organizations, including DIC and all the other major organizations involved in healthcare, going to present, we're from Northampton neighbors, so
we've talked on the phone.
And so the question is, how do we ensure that we're getting correct information? For example, in the last 2 days, I've gotten 3 emails about how to handle this that were erroneous. I mean, the information there was completely wrong.
Yeah.
And then so how do we manage to do that in a way that's consistent and is reaching everybody?
That's a super great question. So the question was about how do we handle all of this influx of information? How do we make sure people are on the same page and what information to trust? And that's something we've talked about quite extensively because we want you to feel like we're connecting with you personally and not just passing along links to things. However, as things change so quickly, it's preferable that people are getting their information from the same area. So what we've been doing is we are linking directly to the CDC and the Mass Department of Public Health. The other very good, reliable source of information is the World Health Organization. And for the most part, hopefully what you are seeing from community partners should be some iteration of that. We are maintaining a daily, bi-daily update on our webpage. However, with the disclaimer that this is rapidly changing, for the most up-to-date information, check the CDC, check the Mass Department of Public Health. Because we understand that in order for you to trust us, we need to be accurate and we need to be on the same page as everyone else. And we are working very hard to have cohesive messaging. Those are the best 2 places to get information.
What is your website?
It's northamptonma.gov.
No, it got cut off. /health department.
.gov/245/health. And it's on our cards, our business cards that we have in the back there. Mm-hmm. Yes, go ahead, sir.
Are there test kits available in this state to determine if someone really has been affected? I've read that there are shortages everywhere.
So we do have test kits. The state lab has test kits currently. The Senate hearing I listened to, the Commissioner of Public Health spoke that they were expecting more supplies today. And they were expecting, I think, in the next few days to increase their testing capacity by 1,000 tests. That being said, all of the testing is mandated by licensing from the Food and Drug Administration, not licensing, use restrictions. So who we can test and how we can test is directly mandated by the federal government right now. There are many commercial laboratories and hospitals that are working to get their own validated testing systems online. These things take time. The interesting thing I learned yesterday is these test kits, a lot of testing we do in the lab is like a little cartridge that you drop the sample on and you plug it into a machine and it spits out a result. This testing is not that simple. So it also requires special staff training and equipment. So, you know, we're working the best we can in the constraints of, you know, developing science as we go. So we do have an adequate number of test kits. The state has reassured us to test people who are designated as persons under investigation. Okay.
Talk a bit about masks, would you?
Yeah, he asked me to talk about masks. So masks currently are only recommended for people who work in a hospital, or if you're visiting someone in a hospital who is on something called droplet precautions, as well as if you are caring for someone with coronavirus or living in a household with someone who is suspected to have coronavirus under isolation. The reason that we are not recommending masks for the general public is, like I had said before, the only way a mask protects you, mask and goggles, by the way, BTW, or eyeglasses, is if someone is within 6 feet of you and sneezes or coughs a droplet that is going to zoom directly into your face and mucous membrane, all right? So that's why we wear masks in the healthcare setting. Those things happen. In the general public, though, like we said, the main mode of transmission is I cough, gets on a table, I eat my food, and then touch my eye. We touch our faces a lot. So the other thing you can do along with washing your hands is try to touch your face less. It's really hard. I just did it like 3 times.
So in the state of Washington, they talked about the fact that the virus was probably circulating there for 6 weeks before the cases began. In San Francisco right now, and they've, done the state of emergency in California, they are, like Amazon delivery people are wiping the screens, disinfecting after every delivery, etc. These are all part of preventive measures. So I'm wondering at what point will that start happening here in this town, on the screens in this senior center where we touch them to indicate what we're doing? When are those kinds of preventive measures of others?
So these conversations have been happening. The city of Northampton has been planning for coronavirus since the first week of January, when we heard that it's out there and it might escalate and it might be an issue here in the United States and or Massachusetts or Northampton. So we have coordinated efforts with all of our community partners, our emergency preparedness team. We are talking about preparing for an event if it were to escalate and how to respond to it. As a matter of fact, we have been preparing in the city of Northampton for an event such like this one, a potential pandemic maybe, for about 18 years now. We've been part of a regional coalition called the Hampshire Public Health Emergency Preparedness Coalition, where we've been preparing for events of this nature. So with that being said, part of the planning process is talking about disinfection. What works, contact times, what's our standard of policy right now, what do we need to do to increase it to help protect the community members. So that's all being worked out. We have central service that takes care of this building here. We made sure that what they're using is effective for as a disinfectant, and we are actually having conversations about increasing how many times a day that this senior center will get cleaned. We know very well that our high-risk population comes and uses this facility. So we're talking about having it disinfected between events, okay? Having it, the increase of disinfection throughout the day and the evening, because there's events happening here in the evening too. So these conversations are happening, it's in motion. I wanted to let you know that it is currently being talked about.
I would also add to that we are in touch with as many people as we have contact information for and as reach out to us. We have a lot of businesses, a lot of just folks in this city. So if you have ideas or concerns, that's awesome. Bring them up to the places you patronize. Say like, I heard this, have you thought about this? We've been preparing for this I haven't been for 18 years, I was in high school, but, sorry. But a lot of our local businesses or community members haven't had to think this way for this long. So that might be, it just, might light a switch for them and they might be, oh, that's a really good idea. So you guys, advocacy is huge. Advocate for yourselves. If you see like at the local supermarket, say like, how often are you cleaning like the keypad kiosk? Have you guys thought about increasing that? Or, things like that are all really, really good ideas. We are a department of a small number of people working as hard as we can. If you guys help us, we're gonna be all the better. So that would mean a lot to us for you guys to, if you have ideas or advocacy ideas. Also, if things work, email me, let me know. That's awesome. I'm always looking for new ideas and ways to connect with our community members to, be safer. So, all the way back there.
Are y'all researching how you guys handle the blue flu? Because that snuck up on everybody also, the 1918 flu. And they dug up a bunch of bodies years ago, and they're trying to resurface this flu to see how they can use it as a defensive mechanisms for biological warfare attacks. So are you looking to see how they handle that blue flu and maybe call Fort Detrick, Maryland, the father of the Ebola virus in 1966? A lot of stuff's been weaponized. It's easy to tweak this stuff when you get to a hot zone, somebody can go in there and tweak it on you. There's a lot of crazies walking around. A lot of them have PhDs.
So I can say we're relying on the people who have those PhDs to do what they have those PhDs in. And we are always learning from the past. We're learning from the distant past. We're learning from the recent past. We're learning from things we did yesterday that we can improve on. So
you're looking at how they, what transgressed from point 1 to point 2 to point 3 with the flu, the 1918 flu, because nobody took that seriously. They just thought that was an isolated situation, and it grew and became worldwide.
Right.
This became kind of situation where it had to have a starting point, and they're having trouble finding a starting point for a lot of stuff. There's a biowarfare weapons lab in Wuhan, China, not too far from where this first started. Nobody's looking at the bad guys. There's other bad guys out there in the government. They're not just a bunch of animals that have been trafficked.
So like I said, there are a lot of people with a lot more expertise in epidemiology and contact tracing and all of that stuff, and I am letting, like I said, we have a certain capacity and a certain number of hours in our week to protect our community, and I am doing that to the best of my education. And
you're gonna press them, you're gonna push their button, see how they like it.
We'll see.
Don't be afraid, the people here will back you up, I'm sure.
Hi, I'm the city councilor for Ward 2, so I have a couple of questions from constituents.
Yeah, wonderful.
One is, what is the temperature required to kill the virus, like if you're doing laundry? And the other one is, what is the test like? And once you get it, are you immune? Can you still be a carrier?
So, laundry, don't know. And I think that that's something with surface contacts. It'd be a really weird job to be the scientist tasked with doing laundry, right? Yeah. To see if viruses are still there. And as far as the test, so what I have heard is we are looking, when we perform a test, most offices have the test supplies. It's very much like getting the flu test. They're asking for a nasal pharyngeal swab, which means up and around the back of your nose, makes you gag a little, not super fun. Oral pharyngeal, same thing, think strep test. And sputum, which is if you're coughing up junk, they want a sample of that. And then we package it up, send it to the state lab, and then they process it. Right now they're saying if demand stays, I don't want to say reasonable, but within what they're expecting, they're quoting about a 24-hour turnaround time. While I can't say definitively, I think what's hard is knowing if you're immune to be reinfected. I don't think we've really run through a full disease cycle yet to know that. Just based on education of what I know about virology, I would say that you have a high chance of being, viruses are living, right? They can change, they can mutate, like the seasonal flu. We are chasing, there are 4 strains we vaccinate for, and a lot of times the flu goes, gotcha, and changes just a little bit, and you get sick year after year. This could be similar. So, if you get it once, it doesn't mean run around, travel everywhere, and sneeze on everyone. You could still get sick, take your precautions.
And to go back to the question about laundry, so we've had a lot of questions come in from our food establishments about that. What's the hot water temperature has to be? So as a standard, it's 171 degrees Fahrenheit with a contact time of 30 seconds. That kills most pathogens. We started researching specifically the coronavirus, and we haven't gotten anything definitive. So we're asking, until we have the answers of those questions, to continue or to change over to using a sanitizer, which will reduce the amount of pathogens. But we are looking into it. The standard is 171 for everything else that we know of.
Sorry, that yellow jacket.
So I'm going to play devil's advocate, but talk about a realistic situation.
Love it.
Somebody who has traveled to a high-risk area now returns to Northampton, and for whatever process they're diagnosed. They have symptoms, they go through the testing, they're diagnosed. Now you've got patient 0 here. They're probably out there already. That's part of what your planning is for, what to do about that. But I'm saying devil's advocate because we're going to just look at realistically look at how some people around here live, which is, let's say, for shopping, Hadley is as much a part of where many people shop. So you now say, where has this person been? They've been to local businesses, but they've also been to, yes, or if involving schools and things like that, but they've gone to Trader Joe's in Hadley and other businesses like that. Hadley obviously doesn't have the resources that Northampton does for a health department or anything else. But it's a place that a lot of us pass through. So I'm sure you've had, that's part of your planning. But I don't think that's an unrealistic expectation that something like that could happen. So what are you doing? Are you now saying everybody who's been to, as an example, Trader Joe's within the time frame that that person has been there, mapping where people have been and is possibly closing down establishments for it to be disinfected, or issuing orders to say no public meetings? When does that happen? Does it take one case? Or, I'm asking a bunch of questions, but I think I should introduce.
So to summarize for people who might not have been able to hear, he was kind of jumping ahead to what happens or is happening if there is someone in our community who is diagnosed who hasn't been under home quarantine, who is out in the community, who if they travel to another community, because we live in a very mobile area, what happens, as well as at what point and what numbers do we start closing things and how do we determine that? So I can speak to part of that, and I think Meredith can speak to the other part about when the trigger point for closing things is. As far as investigation, one of my responsibilities as the public health nurse, I heard a great quote yesterday that a lot of what we do is invisible, which is true. So anytime there is a case of any infectious disease, that can be foodborne illness like salmonella or E. coli or campylobacter or travel acquired illness, or even vaccine preventable illness like pertussis. We are very quick to contact that person and start doing what's called contact tracing.
Right.
So, and that involves multiple communities. We get all of our resources involved. If someone went to a neighboring community, I would call the public health nurse for Hadley and ask them to start looking into this, as well as the DPH is a great resource. And they generally are the ones that take point on anything that would happen in like more than one community. So everything with coronavirus, basically, they would get the report, let us know what we needed to do in Northampton, but they're also coordinating with what needs to happen in Hadley, what needs to happen if this person took a trip to Connecticut and is talking to the Connecticut Department of Health. These aren't novel situations, they happen all the time. We're pretty quick on the response for that. And then sometimes, as you might recall, if there's a measles case, you'll see like little media alerts of like, if you shopped at Target in Framingham between these 2 times, if you have any of these symptoms, and just the messaging part. They haven't made it clear if mass contact, stuff like that for coronavirus will happen or not. But basically, if something like this was to happen, DPH would take the lead on what work each community needed to do to ensure sufficient contact tracing and recommendations for advanced environmental cleaning and sanitization techniques. And I'm going to let Meredith.
Thank you.
That's great. So just to kind of reiterate what Jenny was saying, we do disease surveillance here in the city of Northampton. Anytime there is a communicable disease that's on this list, we get notification from the State Department of Public Health, and then we open up an investigation here. And if it's a Northampton resident, we'll contact the Northampton resident and talk about, their whereabouts, what have they done in a certain period of time. And this period of time looks different for the disease at hand. So we're actively doing disease surveillance and monitoring. In terms of what is the limits for when we close down something or we don't have community events, I don't have an answer for you for that today. We are talking about it. We usually get our guidance from the Massachusetts Health Department. You might have heard of us doing it in the past for maybe like triple E or for measles. So there's precedence that it has been done before. We're just waiting for better guidance. If I was to make the decision, it would be probably event-driven. If I had to make a decision today without the guidance from the State Department of Public Health, but we do work hand in hand with them. This is a larger conversation, and I think, again, it has to be on event basis, because if it were an event taking place here at the senior center, for instance, we're thinking about the Winters Farmers Market that happens here on Saturdays. We want to make sure if we're going to continue to hold it here that there are plans in place on maybe, not being able to utilize the rest of the senior center. There's one entrance in, comes to the great room, and one entrance out. And then we talk about disinfectant again. So we're thinking about it. There's no set parameters as of yet when we're gonna, if we have to close down or ask for events not to take place right now. Yes, in the way back.
I'm wondering about the food supply that we have. In other words, we get a lot of fresh fruits and vegetables from all over the world. Is that changing in terms of how we source our food supply? And also, is there any education to the public in terms of how to actually make sure that their fruits and vegetables are clean enough to eat? If they're concerned about handlers, people who are handling their food?
I think it's the same message that we typically use, wash your fruits and vegetables when you get them. Even if they say it's a bag of pre-washed spinach, wash it again. Jenny, do you have any information? We haven't even been discussing that, but that's a good note that we'll take back and start looking into. But for right now, I would just say it's the same messaging. Just make sure you wash your produce. Blue?
I have a background in agriculture. These producers and suppliers and transporters have vending numbers assigned to them, and they have to be vetted periodically, and in isolated instances, they're just checked, like you check a truck. And you at your level are expecting the USDA to be, and these supermarket chains to be doing all these investigations, but they admit it already, they don't have the budget, and they don't even have the testing materials. Even your doctors and the hospitals don't have sufficient testing materials to test the individual citizen, and how you can test products when they don't even have the test kits. I mean, I know USDA, I won't tell you who, I have family that works for them historically, because I have an agriculture background, and they do have vendors, numbers assigned to them, and they have tracking mechanisms, but if the system is not being funded and they can't check them, they don't have enough people, you guys got to get on them and saying, is this being done?
Sure. So what the gentleman is saying in a nutshell is that there are agencies out there, the USDA, the FDA, all the food that you purchase in any type of commercial setting, whether it is a convenience store, a restaurant, supermarket, has to come from an approved vendor. And being an approved vendor, you also are subject to inspections. But he is saying there might or is not enough available staff and resources to do that. But do know everything that you purchase for consumption here in Northampton and in the state comes from an approved source, and there are inspections that do happen, and we are boots on the ground here in Northampton, and we do inspections also.
Yeah, I wonder what you all know about the supply of ingredients for medications, which I understand for generic drugs in particular largely come from China, and that supply has been interrupted with the quarantines in China and closing down of factories. And so I've heard of one person who's on a medication needed on a daily basis who has not been able to get an extra refill from a local pharmacy. Can you say something about that?
So a lot of our goods are manufactured in China and supply has been interrupted. There are also interruptions in drug shortages that happen quite frequently for a number of reasons. And so my recommendation is if you're having issues filling any prescription medications would be to call either your primary care, like your prescribing physician, or your pharmacy or your insurance company to see if there is an analogous medication that could work. I understand there might be very specialized medications that might just run out, and that is a horrible thing, but there's not a lot we can do. I mean, in the same respect, you wouldn't want factory workers in China who are producing this medication to be at work sick. That would also be very bad. So we can expect some disruption in our global supply chain, even as things, start to go back to normal in China. There will be a lag. Goods don't come in 2 days. So I think that that's something that I'm sure these companies are astutely aware of. But that would be my recommendation, is we have a large pharmacopoeia of medical products. So, see if you can work with your clinician or your pharmacist or your insurance company to brainstorm some alternates if possible. I know there's also talk about putting some guidance and advising insurance companies to allow people to fill medications for a certain extra period of time in case you do need to be under home quarantine. The other things we would recommend are looking into mail order pharmacy, seeing if your pharmacy will provide you a 3-month supply of medication instead of 1. Sometimes pharmacies will do that if you mail order. These are all things that might not be necessary, but are never a bad idea to look into. That way, if all of a sudden you do need to stay at home for that 14-day quarantine for whatever reason, you're not worrying if you have enough of your insulin or your hypertension medication to get you through.
Are you making any recommendations about travel using public air, train, bus, that kind of thing?
So the question was if we're making any recommendations on air, train, bus travel. My recommendation would be the CDC has an excellent website talking about international travel and advisories, and like we said, that is changing daily. So for me to make any specific recommendations would be foolhardy at this point. They are still saying domestic travel in the US is by and large okay. That could change. I will say the horrible and wonderful thing about medicine is we're always learning new things, which is frustrating because sometimes we feel like we can't adequately plan, but at least, we are open to adaptation and change. So right now there is no restriction on travel within the US. We would recommend checking the CDC website before you travel abroad to see what their advisories are. It's stratified by risk group, by current disease situation. And then as far as actually traveling, if you carry sanitizer, I think there was a meeting with airline companies yesterday, and I'm hoping it involved disinfectant and cleaning, but it never hurts to take some wipes, wipe down your seat, things that are those high touch surfaces, and then also wash your hands. So, yes, ma'am.
Just today, there's a local article about the fact that the CDC has recommended that buses disinfect, and that went to PPTA.
That would be great. And I know that Massport in Boston is doing the same thing. They're also increasing disinfectant rates and availability of hand sanitizer at the T stations and commuter rail stations in Boston. So yeah, I'm glad that was addressed. The plaid shirt? Yeah.
I have actually a 2-part question. The first is we saw people getting screened coming off the ships in Japan using a kind of like a heat gun. I presume that was just testing whether somebody had the flu at an elevated temperature?
It was just a thermometer. It's just a fancy thermometer that doesn't touch your head.
All right. The second part of this was I was visiting your friend in a nursing home
Yeah.
yesterday.
Yeah.
And I could, right here in Northampton, I could see no apparent attempt on the part of anybody to take any precautions. And yet, just like you're here talking to us because we're seniors,
Right.
I mean, we've got a lot of ill seniors in nursing homes around.
Yeah.
Is there anything as a city that you consider doing that might mean you traveling to
So-
nursing homes and training the staff and having trainings?
So hopefully if you visit today, that's changed because as of 5 o'clock yesterday, I sent out an advisory just letter to all of our nursing homes in the area. No, we're on it. And it didn't mandate any restrictions, but what I did is, like I said, like we've been trying to do with information, we passed along, CDC has guidance for nursing homes, Mass Department of Public Health has guidance for nursing homes. So what I did was I passed those things along and said, we're all getting a lot of emails. You might have been like me and accidentally deleted one. Here's this. Here's also a list of things that are on the forefront of our minds. You know, are you guys considering if and when to restrict visitors? Are you guys considering how you're going to let your residents connect with loved ones if they're isolated from their visitors? It's how are their loved ones going to get information? Here are some things you can do for people entering, you know, have a logbook, watch them wash their hands, have them meet in a patient's room. Like, so we gave them a big list of ideas, and I hope when I get back to my office today, I'll have some emails with questions and ideas. But like I said, that went out late last night, so but it's good to be mindful, and that very much is at the front of our minds. Our senior community is, you know, that is the one population that has been shown to be very, very affected by that. So I would say all of the planning we are doing, like this is, you guys are the ones that, you know, we are trying to keep in mind with how this will affect you and your lives.
Hi, in base of that, my question is about in the senior community buildings, that they are the high-risk people. When our buildings is not the newest buildings, and the heater or the air condition run through the whole building, and if you have a person that they tested, and they have to be in their apartment, what is going to be the situation for the other residents in the case?
So I can answer part of this, and I don't know if you have anything
Can
to
you
add.
repeat the
Yeah, so
question?
the question was about our seniors who live in like community residences that might have shared ventilation systems, and the systems might not be very new. What happens if someone needs to isolate? So what I can say is there are, in the medical community, there are ways we describe how viruses and bacteria are transmitted. One is called airborne transmission, and the other is called droplet transmission.
Mm-hmm.
So airborne transmission means I sneeze and it hangs in the air. Those are diseases like measles, like tuberculosis. Those are the ones where you hear about needing negative pressure ventilation.
Okay.
In the hospital, we put people with both airborne and droplet precautions in negative pressure as a precaution. However, what droplet means is I sneeze, it falls. So if someone is quarantined in your building that has shared ventilation, it shouldn't be circulating in the ventilatory systems because it's going to be on their tables, because it's going to be on their floors, those things. So it shouldn't be an issue in HVAC systems, as far as I'm aware.
If that's the case, how come so many people board the ships? They were talking about the ventilation system and the circulation in the air in Diamond Princess.
I can't speak to cruise ships. I don't.
What about ventilation systems in hospitals and nursing homes? Or
Right,
even-
they have specialized ventilation systems in hospitals and nursing homes to be able to, we have special rooms in hospitals that have their own specific ventilation system. If someone was to come in with an airborne disease such as tuberculosis, that makes sure it doesn't get in the ventilation. And that is part of their emergency planning, part of their triage. But like we're saying, that from what we know, coronavirus is not transmitted, like it doesn't hang in the air. Like just think of gravity, like airborne diseases, you sneeze and they're kind of like don't really care about gravity. They just kind of hang in the air.
Not even the airplane ventilation systems, they're almost never clean.
Right, so that's where, but it's also like
They're incubators for virus and bacteria.
yeah, and that's why the federal government is meeting with airlines to go over these concerns with them. One of the modes of transmission on cruise ships too is you're living in very, very tiny rooms and you're having, you know, when you can't leave your room to go get food, you have people bringing you food, and you have a lot of instances where if sanitation isn't properly followed, hand hygiene, surface cleaning, things like that, you know, that's another reason. And these all people, before they quarantined in their rooms, also did share a very small space during the incubation period. So it could have been in the dining hall transmission, things independent of a ventilation system. In the back in the maroon jumper.
Hi, I'm wondering about the issue of water. If the droplets can survive on clothing, on surfaces, and you have to scrub your hands with soap to get it off your hands, can the droplets contaminate water? And a follow-on to that is, why are they promoting everybody to stock up on at least 2 weeks worth of water?
So there is what we are doing because of the unique nature of with quarantine and isolation and people staying home for 2 weeks. There is, I don't want to say some mixed messaging, but basic emergency preparedness where we would advise 2 weeks of water for things like if there was a flood, if there was a big snowstorm, things where you could conceivably lose power. So is it good to have 2 weeks of water in your home? Yeah, because you know, we might have a nor'easter tomorrow and you might not have water. So that's kind of, there is combined messaging that they're not doing a great job of kind of separating. It's, you know, we're taking the opportunity to say prepare for being home for 14 days. For any emergency, this is what you should do. For this emergency, your drinking water is fine, your power shouldn't be disrupted, you'll have Netflix, like you'll, you know, it's not gonna be like by a fire, like in a snowstorm.
So can droplets survive in water?
Not that I'm aware of, but there's also, and you can probably speak to this better, sanitation from like in our, yeah, you talked to that, I don't know that.
Our water supply is tested and sanitized, disinfected every single day, multiple times a day, and this virus should not live in there.
Are you advocating the elbow cuff and the sneeze?
Absolutely, 100%. We're also advocating for doing a little elbow handshake or, you know.
Or like I've been really enjoying just like the little like namaste, hello. It's an adaptation. Like it really is. Someone came up to me today and went to like shake my hand and I was just like, oh, nope.
But we advocate for this every year when flu season comes along. Like right now, we're in respiratory disease season. So these are messages that we've been pushing out year after year.
My second question, who is responsible for the temperature in the sinks of the hot water in public buildings?
So that, there's a couple agencies that are involved in that, and one would be the building department. We have a gas and plumbing inspector in there, and when new fixtures are installed, they make sure that the water temperature is meeting a certain requirement. And then in any establishment that the health department permits, which would be a food establishment, etc., we check the water temperatures to make sure that the temperature that's coming out of their 3-bay sink or their bathrooms is meeting a certain requirement.
Have them check the hot water temperature in the building library.
Yeah, that's a good
Okay, thank you very much. Yep. In the back?
All right, I have two things. Someone else, two things, and other people asked me to ask.
Sure.
The Smith person update. The other thing was someone said, and I said, well, this might sound really like very politically incorrect. Please don't put anything on me. This is someone else's question. They said, is UMass, you know, kind of talking to their Chinese population, which apparently is huge, and people come back and forth because, you know, at the end of the season. My question was UV lights. Is that helpful? Like I know some hospitals use that. That was my question. And also my question is money. I mean, they can sanitize hand pads, but I assume money is something they can hold it, correct?
Yeah.
And my other thing was, besides Smith, the money, UMass, was I'm a little worried about if they quarantine people for blowing their nose or sneezing and wearing a mask, they round me up.
Yeah.
Here's why. Because Northampton I think it's a really good time to stop the laundry venting now, because there's a respiratory issue, and people like me are already walking around like this and blowing their nose, and all of a sudden it might seem like they're infected, when it's really clear that in the urban area, it's considered personal choice laundry, but it is definitely a public health matter. And now is a good time to stop that, because I'm ready to buy some liquid butt, it's called, or get something really horrendous to show that anything on your clothes, as long as it's saturated from your clothes through a laundry, it's acceptable, no matter how unhealthy or offensive. So I think it's a good time to laundry. The Smith update is UV light good. What about money and UMass with all the travel back and forth to China? That's a lot.
So I can address, I think, most of them. The UV light is a really good question. I'm going to be meeting with someone this afternoon who I think can answer that question for me, because I do not know. And I think that's an excellent question. In regards to our local colleges and universities, we have been in very close contact with them. We are having a large meeting next week of all of our local colleges and universities. I can tell you that Smith was on the forefront of coronavirus planning. Like, when I still just thought it was a cool news story, Smith was emailing me, their health services center, saying, this is our plan, this is what we're gonna do if something happens, very prepared.
Well, they had someone, that's the question I was asking.
Right.
Specific.
So they had return travelers that were just concerned because they were coming from that area. They were not symptomatic, they were not tested, they did quarantine for 14 days, and they are fine. So that is what we are asking return travelers to do, is if there are certain countries where we are asking people to stay at home for 14 days, there are certain countries where if we are notified people are coming into the country, we are following them for 14 days to make sure that they stay asymptomatic. And the reason it's 14 days is, to the best of our knowledge, that is what one incubation period is. So if you don't show symptoms within 14 days of contact, it is highly unlikely you have the disease. So additionally, I know colleges and universities are suspending a lot of their travel abroad programs, not just to Asia, to Italy, to a lot of continental Europe is starting to have a lot of cases. They're in contact with that. Our local universities are making arrangements, because spring break is coming up. If these international students were planning to travel home to see their families, I know Smith College is waiving fees to stay on campus and encouraging those students not to travel. Some students, if they do choose to travel to those areas, are being asked not to return for the semester, I think. So they are very aware. We are very in touch with our international communities from all parts of the world, realizing that, like we said, we're all interconnected. We all have family and loved ones in different areas of the world, and trying to balance, how to keep those connections and how to keep our community safe. Money. Wash your hands. Money's dirty. It's hard to disinfect, and that's why I said we can disinfect so many surfaces. The easiest surface to disinfect is your hands. If you touch money, wash your hands after.
You said if we have suggestions or want to get in touch with,
Yeah.
it would be from the website.
From the website, and I also have a limit. Myself and Meredith both have cards in the back that have our email addresses and phone numbers.
I was at Cooley Dickinson Hospital yesterday, and and when I was when I was at the hospital in New York City to see my spine surgeon, they have signs everywhere that make sure your doctor washes their hands in front of you, and don't feel bad about asking.
Yeah.
And there are signs up, if you think you might have the virus, please go directly to, and when you enter, they ask if you've been out of the country or near anyone who might have the virus in New York City. So, I'm in New York City, and I come back here, and the virus is in New York, right?
Yeah.
Just by taking something. So at Cooley Dickinson, when I was examined and had my tests, no one washed your hands in front of me or put on gloves or anything, and I know the virus isn't here yet, and there was no signs, but when I go back next week, I'm comfortable, when you get strapped into an MRI machine, and they brace your head, and the chamber goes like all around, and the thing with your neck. Like, I'm sure it's like disinfected,
Yes.
because you're in there a long
Yes.
time. But is there a special procedure that will go into effect? Because like the virus is coming, and you know, you actually would like to like see, you know, like a sign up that everything has been disinfected, or someone's overseeing it. And where would you, I'm sorry, like where would you, you don't want to be rude, but where would you like question that, or like say question to you?
Right.
And I'm sorry, when you enter the hospital, I'm sorry, it's like, when you enter the hospital, like if you think you have the virus, if the virus is indeed here, like do you go, like if you go to your, like the GP is like a pediatrician and you wouldn't want to expose the people in the waiting room, so will there be, like you go to, you know, the hospital if you're infected, or, you know, you don't want to like be around other people in the waiting room? The directions of what to do if it breaks out.
Yeah.
Would that be, could that be communicated on like the City of Northampton website?
Yeah, absolutely. So one of the things in the handout that we mentioned, thank you for your questions, by the way. To recap, I am going to try and address sanitation in hospitals, signage in hospitals, and how to seek medical care if you think you have the virus.
Thank you.
I'm going to address the third part first because it's in this handout in the back, and it is very important. So we are asking anyone who thinks that they may have been in contact with someone who has COVID or and has symptoms to call ahead before seeking any medical care. If you call 911, our dispatchers are aware. If you call with any respiratory symptoms, they will ask you screening questions to keep themselves safe. If you call ahead to the hospital and say this is what's going on. Also, the majority, as far as I'm aware, of primary care providers in the area have signs, as well as are asking you to call ahead. What they will do is they'll do as much screening as possible over the phone, and then they'll generally coordinate to have you come in a different entrance. So you're not sitting in a waiting room with the general public. So that's why we're being very, trying to message the idea of calling ahead, because you're completely right. We don't want to be risking exposing other sick people, right? So Cooley and our primary care providers all have these precautions in place. I am meeting with people from Cooley this afternoon. I will very much bring up the idea that you would feel reassured by better signage. I think that's very valid. MRI machines and large medical equipment are like operating rooms. They are thoroughly disinfected after every procedure. So I don't think we would have to increase the number of times that cleaning occurs because it is already done after every patient. As someone who worked in a hospital for years, I will never be offended if you call me out for washing my hands or say, I would really feel more comfortable if you put on gloves right now. No medical professional should be offended by that. We are doing a lot. It's really easy to forget. We all forget to wash our hands. Being in healthcare, we think we have immune systems of gold. I was very humbled when I had a toddler. I thought, I worked in a hospital for years, I will never catch anything. Joke's on me. You're infectious as an adult, like whoa. So no health professional should mind taking that 20 seconds to wash their hands in front of you. Sometimes they do it before they come in and you don't see. It doesn't hurt to wash them again, okay? So, yes, sir.
A follow-up question. If an event gets canceled or a school gets closed or whatever, who makes that decision? Is it the mayor? Is it you? Is it, who makes that decision?
It's multifaceted, and I'll do my best to speak to it, and then Meredith can as well. Currently, I think one of the frustrating things is there's no overarching guidance, and someone had asked this, how many people, how many cases, at what point? It can be frustrating to not have that guidance to pass to people. However, what is occurring right now is if there is an event, a school, anything in question, we will be contacted, we will consult with the Department of Public Health for the state, and they will work with us because they realize that every town and community and event and situation is unique. So I think what they're holding off on doing is issuing these blanket recommendations to avoid, community is important, guys. It's really important that we all have community connections. We don't want to be preventing that if we don't need to, and if we can do it and keep people safe. So in the event something is going to happen, it will be an individual decision that the Department of Public Health will offer guidance, and then the Department of Health, the mayor's office, and any involved stakeholder, be it the senior center, the school superintendent, will all come together and decide, do we follow that advice, yay, nay, what might work better for our community? But that's, our plan forward right now is to take it on a very individualized approach, because we want to walk the line between being cautious and, you know, risking losing, like, no one likes being at home with nothing to do. So, yes, sir.
Hi, City Councilor Jim Nash, and Jenny, I want to thank you for the conversation, because I was raising a lot of the similar concerns that people are talking about here. I want to thank you for that you guys have put great information on the website, that if people have questions, they can get some answers there, and that you guys are being so responsive. Let's see, a few things I just want to say. Our water system is gravity fed, so when the power goes out, water pressure is maintained. You will have water. It's just a question of whether or not there's clean water.
I grew up on a well, so that's like my
right.
default.
So in Northampton, if you're on city water, you're just fine. Yeah, there are people who have wells within the city, and they should probably have a supply, and that. So the water, if power goes out, you still have water.
Thank you for
toilet
clarifying.
will still flush. I think the important thing that I'm taking away from all of this is that what you're advocating is for us to use practices that we already should be using for cold and flu season. And that if we just really double down on that, we're actually making ourselves, we're taking better care of ourselves. We're doing the things we should have been doing in the first place. Yeah. I'm just finding that that's very helpful. And it's going to help me not get a cold or the flu or further risk of the coronavirus. So anyway, thank you.
Okay. Sorry,
Is the health department putting out signs in the restrooms like we have here in the senior center, in all of the public restrooms, to wash your hands, elbow off, so on and so forth?
Yeah. Yes, we are. A lot of our bathrooms already have signs, but we're making sure that it's the proper message that we want in the bathrooms. They were ordered yesterday from the Mass Clearinghouse, and we'll hopefully have them tomorrow for distribution.
Thank you.
Mm-hmm. Right there in the green, ma'am?
I can't remember if this was addressed early on.
Sure.
You were saying that this has the same way of operating like the flu, et cetera. But is the anticipation that when the season of the flu, et cetera, ends, that we don't worry about this?
The question was, is because this acts the same way as the flu, are we hopeful that when flu season ends, this will die off? We can hope. We don't know. I think there's a lot of people hoping that that's the case. All of us are certainly hoping that's the case, but this is the first time we've seen this. We don't know.
There's been mixed information on the TV.
Yeah, and so I think it's the word hopeful can infer personal feeling or fact. So I think it's, I can see the discrepancy there.
I wish I had asked this question earlier. It seems that everything we hear, it's been that way here, and I understand this is very serious, but nobody seems to talk about what happens when you get the flu, how long will it last, who are dying. I would think it's people that they're already sick, little babies, whatever. What are the statistics about how many are really getting this? A doctor, I finally addressed it only with this quote. And he said, corona is hard to get and easy to get over. The flu is easy to get and lasts a long time. To me, it's like, let's try and avoid a panic.
100%.
This is negative stuff, of course. You got to ask these questions. but I think people would like some information, or should have information, on, you know, maybe it's controllable.
And we would love to give that information, we don't know. And that's the thing, like, we have a lot of data on the flu. We have seen the flu every year for a very long time. Every year our information gets more robust. Our testing capacities get better for the flu. Like, this is something that's been around for a long time. So we have a lot more information on it. That being said, we also, there's a lot of gaps on the flu too. They talk about with coronavirus that a lot of people do get mildly ill. So we don't know how many people actually get this virus because we're not counting a lot of those people that just get a mild sniffle. The same is very true with the flu. The flu is a reportable illness, like we were talking about, to our infectious disease database. So I get notified every time a Northampton resident tests positive for the flu. We can say very safely, that number this year has been, I haven't counted it, what, 60 to 70 cases? We know there are far more than 70 of us in this community that have had the flu. But a lot of times we get the flu and we don't go to the doctor. Yeah. And so those maths make it hard to say definitively, this is this contagious, this is this prevalent. There are, and especially with coronavirus, because it's new, we don't necessarily know the denominator, which is the total number of sick people versus, and that's how we get the death rate, is the total number of people who have died divided by the total number of sick people. Those are